and all the kind of questions that you ask and getting a negative answer. They told her to try to get more rest, drink more fluids, and gave her another appointment that was coming up fairly soon. And the mother, even though she was feeling bad, she decided to take her baby to a clinic where that was run by a lactation specialist because she was having some trouble with breastfeeding and had this appointment, and took the baby for that meeting, came in still complaining of a terrible headache. The lactation specialist looked at her. Her face was swollen. She said, "Let me take your blood pressure." She took the mother's blood pressure, called 911, the emergency. The EMTs arrived with the ambulance. They carried her across the street by ambulance. And later that evening, the doctor called the lactation specialist and said, "Thank you. You went a long way in saving that mother's life. She's gone into eclampsia and has started to seize." And so that mother's life was saved because even though she wouldn't demand to come to see the doctor for herself, she would make that extra effort to take that baby to be seen about. So I think with a combination of these, we will have better coverage and perhaps can prevent the majority of our maternal mortality facilities. And so with that, I'll be glad to answer questions. Chairman Newton.
I really appreciate this bill. I know we've chatted briefly about it, but it came about pretty quickly. But tripling the amount of time, I guess, going from 2 months to 6 months, I think is a big improvement. And one of the things I know we've talked about in the meetings we chaired together were some of the risk factors were hypertension, obesity, and diabetes, and then also the spacing of children, which you have a hard time doing, and just new mothers have a hard time getting back in those 60 days for their regular appointments, as you mentioned, but also even more important, starting to get a handle on being able to space the children apart by long-acting reversible contraception. It would give them 6 months to make that decision and get it done. It also would help them start treating maybe the hypertension, the obesity, or the diabetes that may have made them a high-risk pregnancy to begin with. And I just really think that that's such an opportune time right after delivery, where the mother, at least for 6 months, has the opportunity to take care of her health. And I think you've gotten a great bill here, plus assistance with how they're feeding their children is.
No, you're correct on that, and especially one of the best things we can do to prevent maternal mortalities, low birth weight babies, and the complications and the near misses is for mothers to space their pregnancies. And by going out to 6 months, I mean, you really can't start talking to a mother about birth control when she goes back for that first postpartum meeting and maybe doesn't go back for another one. And certainly by having 6 months, there's plenty of time to start talking about family spacing. The Ohio just did a thing, and they came up with a way of measuring the metrics of what would help with their preemies and infant mortality and maternal mortality. And the one that got a 90-something rating as far as helpful was spacing pregnancies with at least a 1 year space in between them. I think the OBs would like to say 18 months or 2 years, but at least having a 1 year spacing is pretty important. Representative Sharper.
Thank you so much, Chairman. I think we're moving in the right direction, and I think once we can get past this and they see how good this is, hopefully is going to work within the 6 months, and see that we are doing well, then probably eventually bring it out to the full year that that we're really after to really make a difference. Because, but at the appropriate time, I would like to make a motion to pass this.
Okay. I think one of our biggest issues is that right now only 30 to 40%, somewhere between 30 and 40% of our mothers on our Medicaid program now, a little closer to 40%, even go back for their first or any postpartum visits. And so part of this has to be education about how important those postpartum visits are, so that they will utilize this new service that they have. But I'm with you. We've got a good start. Representative Petrie.
Yeah, Yes, ma'am. Thank you, Madam Chair, and I'm really pleased. I was just talking to Amber Park the other day about this, and this is the right thing to do. This is the population of people Medicaid was created for: children and women with children, the disabled, and so I'm pleased with this. I just wanted to say that, just so we're all aware, this paying for this is already in our House version of the budget, and so I'm very pleased with this and very supportive. Thank you.
I don't know which part of the budget you're on, but to anybody that was on the budget, thank you very much. And to the Chairman Parrish and the big chairman of the budget, I am really grateful. I think there's a $19 million in the budget to cover this. I am going to have to leave to go to rules. Wait a minute. We have enough people? 1, 2. Okay, we have enough people without me for a quorum. I'm going to have to leave, and I would ask when we get to that point, there's some people that want to talk, that we would have a favorable vote on this bill. Okay, you go.
I think we have enough to fully expand Medicaid here. You're not recognizing that motion,
Right,
sir.
there's a motion.
Please quickly go through the rules.
We would not want to limit the number of people that can be helped through the Medicaid waiver program by such a small volume.
Thank you, Chairman Cooper. We do have a couple people. We'll go and get started with a little bit of public testimony. I know we all have. I'll call you if I need you. At this point, let's see. Mary Lee Gober, sorry. Hey, Mary Lee. Thank you
Hi.
for your.
I'm Mary Lee Gober. I'm a registered nurse and an attorney, and I'm here on behalf of Georgia Health Advocates, the National Lactation Consultant Alliance, and the Southeastern Lactation Consultant Association. We support the provision for a Medicaid benefit of lactation services in this bill. With 16 baby-friendly hospitals in Georgia, 84% of our new mothers go home breastfeeding, but only 22% are able to meet the AAP recommendation of breastfeeding for 6 months. Mothers leave the hospital before their milk has even come in. When they are at home, they have issues, and lactation consultants are the highest trained, lowest cost clinicians who can help our mothers who have those breastfeeding difficulties. And they are often the only clinical person that a mother may see during those first 6 weeks postpartum. In addition to addressing breastfeeding challenges, these folks can also screen and refer for other medical conditions, such as postpartum depression, and as Representative Cooper alluded to a moment ago, high blood pressure issues that can be critical and life-threatening to a mother. We want our mothers and babies to be able to have the many health benefits of breastfeeding. It is particularly important right now with the COVID-19 virus in this state. Babies need the immune properties and protection that only breast milk can provide, the living maternal antibodies that are in mother's milk. And at this point, it is also possible that sometime in the near future, we are going to have a supply chain issue with infant formula. So as many mothers and babies who can breastfeed, they need to be breastfeeding, and they need to have access to lactation consultants who can help them do just that. And this bill will solve that issue. So thank you very much. Oh, any questions?
Thank you for your work. Are there any questions from the committee? If not, thank you. Tim
Kibler with the Georgia Alliance of Community Hospitals. Mr. Chairman, thank you for allowing us to testify. We very much support this legislation. We share Representative Sharper's aspiration that we can get to a full year of coverage, but the expand to 6 months will address the vast number of adverse incomes that Georgia's vulnerable mothers face. And the passage of this bill and the signing by the governor will be a great day in helping Georgia's most vulnerable mothers have a much better chance of a successful outcome with their pregnancy. I'll be glad to answer any questions.
Thank you. Are there any questions from the committee? Thank you for your testimony. Betsy Bates, thank you for being here.
Good afternoon. I'm Betsy Bates, and I represent the March of Dimes, and I'll be brief. We're here in support of this measure. We are supportive of the Maternal Mortality Study Committee. We've been working on this maternal mortality issue for years, and as you said, we'd like to see it at a year, but we also understand the budget constraints, and we're supportive of this bill, and we appreciate it, Chair Lady Cooper, bringing it forward and everyone's support.
Thank you. And Bethany Sheriff.
Hi, I'm Bethany Scher with the Medical Association of Georgia, and we just want to voice our support for this legislation. Thank you.
Thank you. Thank you. All right, at this time, what's the committee's pleasure? Representative Sharper.
All right, I motion that we do pass LC 338346.
Motion do pass. We have a second. Is there any other committee discussion? Hearing none. All in favor, aye.
Aye.
Those opposed, no. And the bill passes. We'll go on to rules now. Thank y'all for being here today. Thank you for participating.